My name is Megan Lamb and I will be presenting addictive behaviors in Australia. Views on addiction. When Australians heard drug addictions, they assumed meth. This is especially prominent in individuals aged 50 and older. When younger Australians heard this same phrase, they assumed cocaine, therefore the view on drugs in Australia differs based on age. Overall, Australians think alcohol is the drug that causes the most deaths. In 2019, 23% of Australians approved of the regular use of cannabis compared to 15.5% who approved the use of tobacco. 46% of Australians approved of adults using alcohol regularly. The disapproval was highest for heroin at 95% and meth at 93%. Between 2007 to 2022 and 2023, the acceptance towards the use of some drugs in Australia has increased. In conclusion, some drugs such as alcohol and tobacco are considered culturally acceptable while others such as heroin and meth have a more negative connotation. Addictive habits. 10.6% of adults in Australia age 18 or older smoke cigarettes, pipes, or cigars daily. Australian women have a lower prevalence of smoking than men. Between 2022 and 2023, 31% of Australians 14 and older abused alcohol, risking their health. 8.8% of Australians have used marijuana in their lifetime. Overall, the use of addictive substances rises each year. Risk factors for substance abuse. Substance abuse can be amplified based on a person's experiences, which makes up their risk factors. Common risk factors include genetics, social and environmental settings, and an individual's personality. Genetically, substance abuse is a heritable trait. Socially and environmentally, an individual's family stability, employment status, illness, abuse, and relationship status can act as risk factors for drug use. Additionally, emotional distress, poor mental health, first-hand witnesses of drug use, and detachment from the educational system are risk factors. Individuals with poor mental health may use substances to improve their mood, temporarily leading to addiction. Connections between addiction and health issues. Tobacco makes up 7.6% of Australia's disease burden, causing cancers, respiratory and cardiovascular diseases, and infections. Alcohol makes up 4.1% of Australia's disease burden, causing alcohol dependence, cancers, cardiovascular and chronic liver diseases, and injuries. Illicit drugs make up 2.9% of Australia's disease burden, causing drug use disorders, poisoning, hepatitis B and C, and HIV and AIDS. Illicit drugs include opioids, amphetamines, cocaine, and cannabis. 11% of participants in an illicit drug reporting system reported a non-fatal heroin overdose in the past 12 months, while 19% of participants in a similar system for ecstasy and related drugs reported a non-fatal overdose in the past 12 months. Suggested solutions. The goal of primary prevention is to prevent addiction before it happens. Some examples of primary prevention for drug addiction include supporting the youth's growth and development academically and socially. Instilling confidence and professional values in the youth reduces their drug use. Social programs that support families who need help meeting basic needs can help reduce socioeconomic risks of developing addiction. These social programs target food, housing, and healthcare. Secondary prevention focuses on preventing the early stages of addiction from worsening. An example of this is providing sensitive care when treating people in the early stages of addiction in order to prevent re-traumatization and support recovery. A similar example is to provide culturally sensitive care in order to make patients more comfortable when seeking care. Lastly, it should be standard to train healthcare providers to recognize the symptoms of early addiction. This prevents addiction from being underdiagnosed, allowing healthcare providers to treat addiction before it worsens. These are my references, and thank you for watching.